Welcome to The Explainer. Today, we're tackling a question I guarantee practically everyone has frantically Googled at 2 a.m. Is my body actually trying to warn me about a serious illness? It's a fascinating question, right? I mean, our bodies are these incredibly complex machines, and they're constantly sending us signals. So today, we're going to break down 7 specific warning signs you absolutely shouldn't ignore, all based on the latest health consensus.
So, does your body actually try to warn you? Let's dive right in. We all know that sudden, stomach-dropping feeling of anxiety when you notice a strange, lingering symptom. You're sitting there wondering, okay, is this just a totally normal ache, or is my body trying to tell me something huge? Look, it's a completely natural reaction. We're literally wired to pay attention to changes in our health. But before we get into the nitty-gritty of those 7 signs, we really need to set the right baseline for how we're interpreting these signals.
Because here's the thing. When we notice a new symptom, our minds almost always jump straight to the absolute worst-case scenario. We immediately think, cancer? But let's set the record straight right off the bat. While warning signs can be serious, having one or more of these symptoms absolutely does not automatically mean you have cancer. Actually, most of these signs are caused by much more common, super treatable, and completely benign health issues. The goal today isn't to freak you out, it's to equip you with the knowledge to know exactly when a symptom crosses the line from just a normal bodily hiccup to something that, requires a professional look.
All right, let's jump into our first group of signs. Section 1, energy and weight changes. Listening to your body's fuel.
Our very first sign is unexplained weight loss. Now, have you ever noticed your clothes suddenly feeling loose even though you haven't touched your diet or exercise routine at all? Losing a noticeable amount of weight without even trying isn't just a lucky break. It's a bit unusual. Now, it's totally normal for your weight to bounce around a few pounds a day just from water weight. But if you're dropping 5% or more of your total body weight over, say, 6 to 12 months without putting in the effort, that's your clear signal to check in with a doctor. To put that in perspective, if you weigh 200 pounds, that's losing 10 pounds out of the blue. Again, do not panic. This is way more often caused by things like just high stress, an overactive thyroid, diabetes, or digestive issues. But because certain conditions can mess with how your body processes energy, it's a sign that definitely warrants a quick evaluation.
Moving right along to sign number 2, extreme tiredness that just will not quit no matter how much you rest. Look, everyone feels tired sometimes. Long hours, a couple of terrible nights of sleep, or a crazy stressful week can leave literally anyone completely wiped out. But what we're talking about here is extreme fatigue that drags on for weeks and doesn't budge even after a solid weekend of sleeping in. If your exhaustion is actually messing with your daily life, it needs attention. But context is key here. The usual suspects, they're typically anemia, passing infections, awful sleep habits, or just plain old stress. Sure, in rare cases, it can be a warning sign for something bigger, but the vast majority of the time, it's a super treatable issue that your doctor can easily help you sort out.
Okay, moving on to section 2, physical and skin changes, what you can see and feel. Sign number 3 is finding a lump or swelling that refuses to go away. Finding a lump literally anywhere on your body can instantly send your heart rate through the roof. It's scary, I get it. But remember our golden rule here. Most lumps are not serious. They're incredibly often just swollen lymph nodes fighting off a minor cold, totally harmless cysts, or some other everyday condition. That being said, there's a really clear action plan you should follow here. First, notice the lump. Second, observe how it acts. Does it feel hard? Is it getting bigger? Third, wait a few weeks. If it doesn't just naturally disappear, or if it keeps growing, step 4 is to go get a medical evaluation. Getting it looked at early is always your smartest and safest bet. Our 4th sign revolves around your skin, which honestly can act like a billboard for your overall health. You really need to keep an eye out for changes in a mole or a random skin spot. Now, most skin changes are completely 100% harmless, but what you are really looking for is evolution. Watch out for a mole that starts changing in size, shape, or color. Notice if the borders start looking uneven or jagged, if it just randomly starts bleeding, or if you have a spot that stubbornly refuses to heal. If a spot is persistently evolving over time, you absolutely need to get a medical professional's eyes on it just to be safe. Next up is section 3, discomfort and internal changes, signals from the inside. Sign number 5 is a lingering cough or hoarseness. Most coughs are totally run-of-the-mill. We're talking viral infections, seasonal allergies, or maybe a reaction to smoke. But here is the critical timeline you really need to keep in mind. Week 1, totally normal. Week 2, annoying, yeah, but it's probably still just running its course. But that 3-week mark, that is your trigger. A cough that hangs on for more than 3 weeks, especially if it seems to be getting worse, needs medical attention. And actually, this becomes pretty urgent if the cough brings up blood, comes with unexplained weight loss, chest pain, or if you're suddenly short of breath. And the exact same rule applies for a persistent hoarse voice that just won't clear up. All right, sign number 6 involves changes in your bowel or bladder habits. Let's just be real for a second. Occasional constipation or diarrhea happens to literally everyone. It's incredibly common, and it's usually just tied to eating something weird, a passing bug, or honestly just a really high-stress week at work. But if you start noticing ongoing changes that stick around for several weeks, we're talking persistent constipation, nonstop diarrhea, pain when you use the bathroom, or suddenly needing to go way more frequently than what's normal for you, well, that deserves a proper evaluation. These symptoms have a massive variety of possible causes, most of which are super easy to fix, but they definitely shouldn't just be ignored. And our 7th and final specific warning sign is unusual bleeding or sores that just will not heal. Look, any unexplained bleeding should always be taken seriously. This includes blood in the stool or urine, coughing up blood, unexpected vaginal bleeding, or even just a weird sore inside your mouth that hasn't healed up after 2 or 3 weeks. Now again, take a deep breath. Most of these symptoms are caused by things that have absolutely nothing to do with cancer, but they are bold, glaring red flags from your body that require a doctor's visit to figure out exactly what's going on under the hood and get it patched up. Which brings us to section 4, when to seek help. The golden rule of persistence. If there is literally only one word I want you to take away from this entire explainer, it's this one: persistent. The secret to everything we've just talked about comes down to persistence. Quick temporary hiccups in how your body works, perfectly normal. But a symptom that drags on for several weeks, one that actively seems to be getting worse, or one that has absolutely zero obvious explanation, that is the exact definition of a persistent warning sign. If you notice a persistent symptom, or even worse, a few weird symptoms happening all at once, well, that's your cue. It is time to take action. So let's lay out a super simple, entirely stress-free action plan. Step 1, do not panic. Like we firmly established today, these signs are almost always caused by common, highly treatable stuff. Step 2, and seriously, I cannot stress this one enough, step away from the search bar. We all know that falling down a late-night medical internet rabbit hole always ends with some forum telling you that a mild headache means you have 3 days left to live. Just don't try to diagnose yourself online. And step 3, simply call and schedule an appointment with a qualified healthcare professional. Let the actual experts do exactly what they spent years training to do. And that brings us to a really empowering reality. Seeing a doctor early isn't about, confirming your darkest, worst-case fears. It's about optimizing your health. An early evaluation identifies exactly what is actually going on, whether it turns out to be something serious or just a pesky minor infection. And catching things early almost always leads to far better health outcomes. It basically puts you firmly back in the driver's seat of your own well-being. So we've explored the signals, the timelines, and the incredibly common, completely non-scary reasons our bodies sometimes act up. The major takeaway here is to just stay observant. Ditch the unnecessary panic and really embrace the power of getting a professional early evaluation. Which leaves us with one final essential question you should probably ask yourself today. Your body is talking. Are you ready to listen?